Hello and good evening, everyone. Welcome to The Big Idea, voicing what's next in healthcare, which is Voice of Healthcare's newest virtual mini interview series that features leaders and visionaries from all the walks of healthcare through a quick one-on-one Q&A style. This breezy, snackable show is a quick, refreshing dip for those who want to stay updated on all newsworthy content in healthcare. In this series, our eminent guests will empower you with the expert insights on disruptions, practices, and trends in the healthcare industry that are worth exploring and worth sharing. For this episode, our guest today is Mr. Himanshu Baid. He's the managing director of Medicure Ltd, also known as Polymed. He founded Polymed in 1995 with his brothers and has over 24 years of experience in manufacturing disposable medical devices. He's involved in corporate strategy, finance, sales, and marketing initiatives of Polymed. Welcome so much, Mr. Well. It's a pleasure to have you here. So let's start with the rounds of discussion for today. To start with, I'd request you to please share your journey from being an engineer with electronics and communications major to now being an MD of the medical devices company. Over to you, sir.
I started my career as an electronics engineer and I was part of the family business. But at some point of time, I thought I need to do something new in my life and something different. And this idea of medical devices was conceived by my father at that time. And he himself is a great entrepreneur, started many businesses. So he told me that why don't you explore deeper into medical devices field? And we were already into plastic manufacturing and something which was adjacent to what we are doing, but not really exactly what we had to do in future. But I think from that beginning, that entrepreneurial spirit which I had from my father, and then of course support from my brothers, we were able to start a new company and set up a manufacturing company in Faridabad. We began in Faridabad. I moved from Jaipur. It was a smaller city where it was very difficult to find skilled people in the field. So being in NCR region, I could find more skilled people who had a bit of idea in manufacturing and about different processes needed to make medical devices. And from that, I think beginning, I think we are what we are today in terms of company, in terms of what we have done so far. So that's the story.
Well, thank you so much, Mr. Baid, for taking us through your inspiring journey and how you set up Polymed in the first place. Moving on, I'd like to ask you what was your motivation behind starting this company and what were the biggest challenges you faced while starting out?
No, I think that's a great question. And first of all, I think being a startup organization or let's say first generation organization, the first thing you need is capital. Because today I think technology is very widely available to make any product, and or you can find collaborations or partners, or you can collaborate with academic institutions today. There are a lot of things available, but at that time capital was very, very expensive, or borrowing money from the banks was very expensive, and even to get loans was very difficult. So to me, I think that was my biggest challenge, to find the money to start the manufacturing process, the company, find the working capital. The second most challenging thing was to build an organization, people you can work with, people you can trust. And companies are not run by few people. You need a very large group of people who can run organizations. So how would I find those people? How would I know that those are the right people for me and they would work long term in the organization? Because it's a starting point. And would people work for an organization which doesn't even know that it will survive for next 2 months or 2 years? So these were big challenges for me at that time. And I think the biggest factor which made us survive this crisis was hard work. There's no substitute to hard work. So there were times we were sleeping in the factory. There were times we were working with the workers along with the factory. So so you motivate people, you charge them up, you tell them what is the right thing to do, and you learn from mistakes. So that was the initial part of the period. And then of course, to focus on development and R&D. So these are few things which India and entrepreneurs miss when they start a new organization, new company, that you have to dedicate some part of your revenue to R&D, for new development, for new research. Because we just say, okay, I'm going to make a product and just get immersed into that. But also look at what is going to happen 5 years from now, what is going to happen 10 years from now, what are the disruptions coming in technology, what happens if this product completely stops and something else comes in the market. So these are the kind of things you have to think over. And I think our investment in R&D, being an engineer, my brother Rishi being an engineer, of course, my youngest brother Vishal is a chartered accountant, but we're a great team to work together. And because of that, I think our focus was R&D, and we continue to invest in R&D. So from there, the journey started, and the people who worked for us, they were also very, very passionate of what we were doing.
Thank you, Mr. Beth, for that. Moving on. Polymed has consolidated its position as the largest exporter of consumables, medical devices for the last 8 years in India. To which personal attributes would you like to dedicate this success?
See, I think in healthcare, you need to be aware what's happening around you. You need to partner with clinicians, doctors, understand what is the real need. And are you able to meet that need? Are you able to meet that need with a better quality product, or maybe a lower priced product, so that it eventually helps the patient to get that treatment, and it makes the treatment cost lower comparatively. And then it's all about learning. So in healthcare or health technology, medical technology, you have to learn every day that what this product can actually do, or how can it perform better. What can I do to alleviate the pain, or like reduce the pain of the patient? How can I do elevate the way nurses adapt to a new product? So these are very important areas to focus on. Continuous dialogue with the clinicians, continuous learning process, educate yourself as much as you can, look at globally what your competitors are doing, what your peer group is doing, what kind of new technologies they are adopting, whether you can do the same or can you get closer to that. So these are the things you have to keep on doing to run a, let's say, a successful medtech organization.
Thank you so much, Mr. Beth, for that. Now, moving on. Now, I'm sure since having such rich years of experience in the industry and healthcare fraternity, I'm sure that there are many setbacks and challenges that you might have faced during your journey. Now, in your mission to provide medical devices at an affordable cost, could you please share the major setbacks you faced that immensely shaped your career as an entrepreneur?
So I think when we started, and I think India was never a market for disposable products. Almost all medical devices are being reused, re-sterilized, so they were meant for single use. So to bring that concept of single use medical devices was a very difficult thing to do. To convince people to use and throw devices, because India people like to extract value from everything, because we are actually mentored like that in our life. That don't throw away stuff, try to use it, or trying to find another way to use that product. So and there are many examples, I'll not go into that. So here that was the biggest challenge. The second thing was a brand like you're making in India, so that has to be cheap and bad quality. But that was the perception of people about Indian products. Because everybody was saying, if I go to a doctor, oh, I need an imported device. I use a Japanese, German, or a US made product, or European made product. So why should I use your device? If there's a risk on the patient, who will be responsible? Why should I use my patient as a guinea pig for you to make trial for your device? So these were the initial challenges. So I think in today's world also, a lot of young entrepreneurs, they have great ideas, brilliant ideas, but they feel challenges how to make their product available in hospitals, how the product can be used by the user, how to convince the user. So that is the biggest thing, which as an entrepreneur everybody faces. But I think the only solution to this is you have to persist, persist, and persist. There's no other way you can get around this, because you have to keep on talking about the good qualities of your product, the user advantages of your product, and convince the user to use your product, and stand beside them. Okay, if something happens, I'm responsible. So these are the things, and we have spent a lot of time doing that, and it has taken me so many years, I would say, to build a brand. To build a brand out of India is very, very difficult. Today, tell me, even nobody can tell three brands which are popular outside India. Very hard to say Indian brands popular outside India. Today in Germany, which Indian brand is popular? Or in UK, which Indian brand is popular? So it's very difficult to build a brand. So invest in the brand, invest in quality. I think these are very important things, I would say.
Thanks so much for that, Mr. Baid. Polymed will be completing 25 years this year, and many congratulations on that success. Could you please share how the medical device sector has evolved throughout these years and what do you foresee for this sector?
Well, it's a very big question. I think we all are conscious of things happening around us, and especially the environment issue. And you see, recently, Government of India has come with a notification to ban single-use plastics. Now, most of the medical devices are made from plastics. They are single use. So, is it covered? No, it is not covered because these are essential products and there is no substitute. Because these are materials, certain materials which are biocompatible, which are compatible with drugs. So, when you deliver drugs through medical devices, the product has to be compatible. It has to be inert. It cannot react with the drug because then it will not be the efficacy of the drug will be probably will lose that efficacy. So I think we have to continue to invest in technologies where we can maybe incinerate without, let's say, hurting the environment, find new ways to handle plastic waste, and probably also find out new products which are biodegradable. Today, most of the plastics are not biodegradable, or even they are biodegradable, they will take thousands of years to biodegrade, disintegrate, and mix with the environment. So we need plastics which are biodegradable at a much faster pace, maybe less than a year, 2 years, 5 years. So I think those studies are going on. Maybe in future, 5, 10, 15 years from now, we will have more smarter materials coming out, materials with nanoparticles embedded inside, whereas those nanoparticles will help to disintegrate the integrate that plastic, or make it more biodegradable. So newer technologies will come in future. So there's a lot to do today. Our new entrepreneur who wants to start a new business, I would suggest start researching in biodegradable products, biodegradable plastics which are environmentally friendly. So this is what is going to happen. And I think in last 25 years, I would say that a lot of changes happen in India. There's a focus from government of India on medical devices, medical device industry. We have PLI scheme. We have medical device parks coming up. We have products getting regulated. So a lot of things have changed in the last 25 years. Things have happened for good, for positive. So and this industry has now become kind of more prominent because earlier we were pretty much under the radar as an industry. So a lot of things have changed, I think.
Thank you, Mr. Baid, for that. Now, moving on, while we are talking about all the setbacks and challenges and everything, now to foresee the vision of Polymed, please share your plans of expansion for this year. We would like to know what's next for Polymedicure.
See, I think our focus is again to provide affordable devices to patients and make them in India. Can and make India self-reliant in medical device space. Today we are 70 to 80% import dependent, especially for high technology and medium technology devices. Let's say we don't even make stethoscopes in India. We don't make BP instruments in India. We don't make even a thermometers in India. Basic products. We are lacking completely. So what Polymed can do here? So as a company, we have started even for most of the dialysis products were getting imported. So or any product which is used even for common treatments are being imported. Glucometers for blood sugar monitoring or pulse oximeters you've seen in recent COVID times or oxygen concentrators. Simple products, we were not making them in India. We are only relying on imports. So I think the most important thing for Polymed going forward is to indigenize manufacturing, look at import substitution, what we can do better in India. Can we scale up manufacturing? Today we are exporting to 120 countries. So can we leverage our knowledge, our reach, and bring new technologies, new devices into India, manufacture them, make them cheaper for masses? And we are already investing in 3 new manufacturing plants already as we speak. We're a public company, so all this information is in public domain. Two new plants will be ready by end of the year. One plant will be ready by end of 2023, and one new plant will be also ready in 2024. So we continuously investing in upgrading our infrastructure, creating new infrastructure, so that we can make more and more products in the country.
Many good luck on all those visionaries and all those goals that you have for Polymed. Now, moving on to the separate segment of this entire interview, which is called the big idea questions. Now, the big idea question for you would be, what should be the focus of medical device manufacturers in the present time?
So I think the next thing which we have everybody has to look at is digitization of medical technology. Today, a lot of this technology, whether talk about health records, we talk about, you know, distance medical treatment, where, doctors at a distance and they still treat patients through, telemedicine. There are devices which can record data, and then this data would be the new oil, which we all heard before from many people. So data will play a very important role. The more data you have, the better devices you could be able to design, more, let's say, focused treatments you'll be able to do for the patients. So I think digitalization would be very important going forward in medical technology. And there are many areas which can be covered in the digitalization program. And of course, preventive healthcare would be a big area to look at. Today, people mostly go to hospitals or get treated when they are probably chronic, they are having chronic diseases, but I think, can we prevent those things? Can we do screening much before then the disease comes? So the screening, pre-screening, screening what from the right age, like what are the, and probably looking at the database of the area, figuring out that what kind of, let's say, diseases are there, disease burden is there in that area. Can we screen people, tell them beforehand, whether they need this kind of medication to prevent that, stop cardiac diseases happening in India, stop, diabetic issues, stop renal issues. These are conditions which can be easily solved and managed. Can you pre-screen and manage them? So these are preventive health will be a big area. Then I think third area would be on collaborative efforts between doctors, medtech companies, and academia. Can all three combine together, work together, and develop new devices, and which is pretty much possible according to me.
Thank you so much, Mr. Baid. And with that, we mark the end of today's episode. Thanks again, Mr. Baid, for sharing such an enriching and insightful experiences of your journey, and also letting us know the future goals that you have envisioned for Polymedicure. And we wish you all the luck for that. To all our viewers, thank you so much for logging in for this conversation. And for all of you, just to let you know that we have many such interesting conversations in our upcoming episode. So to keep yourself updated, please keep following all the updates on the big idea. And we can't wait to see you in the next episodes. Thank you.